Morning, everyone, to the Thursday, October 21st media briefing from the Windsor-Essex County Health Unit. I will pass it on to my colleague, Ramsey D'Souza, who will provide the EPRI summary presentation.
Thank you, Mike. Good morning, everyone, and thank you for joining us for this week's EPI presentation. So we'll begin, as usual, with looking at what's happening in Canada across our country, then specifically zooming into what's happening in Ontario, and then wrapping up with what we're seeing locally in Windsor-Essex. In Canada, we have been seeing a decline in our cases since the fourth wave has begun. We're currently averaging about 2,800 cases a day in the past 7 days, whereas this time last week we were seeing about 3,500 cases a day. So a decline of about 700 cases a day. When we move into what we're seeing in Ontario, just like in Canada, we're continuing to see a decline in our cases. Currently, we're seeing about 407 cases a day in our province, whereas this time last week we were seeing about 530 cases a day. When we look at what we're seeing in Windsor-Essex, we are seeing a gradual decline in our cases too. Our current 7-day average is currently at 29 cases per day, whereas this time last week we were at 35 cases a day. The drop in our cases isn't as dramatic as what we're seeing in Ontario and Canada, yet we are still decreasing. When we look at our case rates in Windsor-Essex by week, in our most completed week, which is week 41, our case rates once again has declined. Our current case rates for the full completed week is at 47 cases per 100,000 population, which is a decrease from last week, which was at 50 cases per 100,000 population. In the most recent 7 days worth of data that we have, our 7-day case rate is at 45.8 cases per 100,000 population. And this is once again a decrease in the week prior for the most recent 7 days, which is at 47 cases per 100,000 population. So how do we compare with our colleagues in the Southwest and across the province? Across the province and in the Southwest, just like us, we are seeing a decrease, though our case rates are slightly higher than what we're seeing in the Southwest. When we look at all the PHUs in the province for the most recent completed week, which is week 41 from October 10th to October 16th, we now have the 5th highest rate, which is a drop from where we were last week, where we were 3rd in the province. We're currently surpassed by our neighbors in Lambton and in Chatham-Kent, Eastern Ontario and Southwestern Ontario. When we look at our wastewater surveillance data, which is the red line here, our wastewater has generally remained unchanged from this time last week. There is some fluctuation that which we're observing, but relatively it remains unchanged. When we look at our tests that people are doing for COVID-19 and the test results in terms of what they have, about 3.6% of the tests for the most completed week ending on October 16th have returned as positive. This is a slight decrease from where we were last week, where we were at 4%. Last week, approximately 5,800 tests were completed. So how do we compare once again with our colleagues across the province? We do have the 2nd highest percent positivity in the most recent 7 days, only to be surpassed by Lambton County. In our most recent 7 days, our percent positivity is at 3.8%. When we break down our percent positivity by age groups, what you'll notice that in the most recent 7 days, for the age group 0 to 17, 18 to 34, 35 to 64, they're all hovering around the 3.5% positive for 4% positivity. This is great news, especially for what we're seeing in the previous weeks, especially in our 0 to 17-year age groups where it was much higher and hovering at about 4% or higher. In our 65-year age group, our percent positivity has remained fairly low and is currently sitting at 2.3%. Moving on to our rates by municipality, looking at our rates from October onwards, Leamington has the highest case rates, followed by Essex and Tecumseh. When we look at the distribution of our cases by each of the municipalities, Windsor continues to have the highest percentage of cases at 54%, though we are seeing a larger amount of cases coming from Leamington as well in the past 30 days. When we look at the most recent 7 days, that number is higher for Leamington, where about a quarter of our cases are coming from that region, and about 56% of our cases continues to be from Windsor. When we look at our age and sex distribution for the past 2 weeks and the overall pandemic since the beginning, we see a similar trend to what we're seeing in the past few weeks. In the age group 0 to 19, we continue to see about a third of our cases coming from that age group, whereas currently we're seeing only about 1% of our cases in those 80 plus. When we look at how our cases are acquiring COVID-19 from October onwards, almost 40% of our cases are acquiring COVID-19 from their household contact, and just over a quarter of our cases are acquiring COVID-19 from an unknown source in the community. Zooming into our case counts for our school-aged children, for the most recent completed week, we have seen a decrease in our 7-day average for our cases, which is the dark blue line. And if we look at the green bars at the bottom of the screen, we are also seeing a decrease in cases among our school-aged children. This time for this week, our 7-day average is sitting at 7 cases, whereas this time last week, we're seeing about 9 cases a day among school-aged children. So comparing our 7-day averages for our school-aged children and with our overall population, across the board, we are seeing a decrease, though we did see a dramatic drop in our 7-day average in our school-aged children for the most completed week. Moving on to our hospitalizations in Ontario and Windsor-Essex. In the most recent week, our hospitalizations in the province and locally has remained relatively unchanged. Similarly, in our ICUs, our ICU admissions for COVID-19 too in the province and Ontario has remained unchanged. When we move on to our doubling time across the board in Canada, Ontario, and locally in Windsor-Essex, our doubling time has improved again from where we were last week, and this trend continues. For our most recent median R0 sits at 0.9. This continues to be less than 1, and when the R0 is less than 1, each new case leads to less than 1 new infection, signaling that our cases in the region are decreasing. Moving on now to COVID-19 vaccines locally in Windsor-Essex. Looking at the number of vaccines we've administered from first doses to third doses, for the most recent 7 days in comparison to last week, the number of doses that we've administered has remained relatively unchanged. We do see some fluctuations between first and second doses, but overall it remains the same. This graph just looks at all of our doses administered, whether it's first, second, or third, and using the 7-day average as well, and we can see that generally speaking, it remains unchanged. For the most recent 7 days, we were administering about 706 doses a day. When we look at our coverage rates for at least 1 dose by age group, we are seeing improvements once again. About 75% of those 12 to 17 years of age have received at least 1 dose. Whereas overall, if you look at our entire region, including those that are not eligible to receive a vaccine, our coverage rate sits just below 75% for at least 1 dose. When we look at our fully vaccinated coverage rates, there is still some improvements to happen or to see. For our 12 to 17 and our 18 to 24 year age groups, they're still in the 60s, and there's still some progress to be made there. Whereas overall, for those 12 plus who are eligible to receive the vaccine, we're now at just over 80% of that population group that has received 2 doses of the vaccine. This is a new slide. This looks at all of our postal codes for at least one dose, including our hotspots and overall. There are some regions, there are some postal codes such as the N9A and NOP postal codes where the first dose coverage rates remains low and and is lower than what we're seeing in some of our hotspots and in our overall coverage. Similarly, when we're looking at our completed vaccination series for 2 doses in our region, there are some postal codes, once again the N9A and the NOP, that have lower coverage rates, and they tend to be lower than our overall coverage rates. So how do we compare to other PHUs in our province? So we for at least one dose, we are starting to move closer to the middle of the pack. We're about 3 or 4 PHUs away from being exactly in the center, though we continue to be lower than the province. Likewise, for those fully vaccinated residents that are 12 plus, there are still some improvements to be made, but we are making some good progress in moving away from the lower end of the province to moving to the center of the pack. In summary, case rates this week have continued to decline. Our wastewater surveillance data has remained relatively unchanged from this time last week. Just as we're seeing in the past couple of weeks, there is a higher number of cases among children and youth. Hospitalizations and ICU admissions have remained relatively unchanged, with some fluctuations that we've observed. The number of doses that we've administered, whether it's first, second, or third, has generally remained unchanged from where we were last week. And when we look at our monitoring indicators, 47.7 cases per 100,000 is our case rate for our most completed week. And for the most recent 7 days, the case rate is 45.8 cases per 100,000 population. For our most completed week, our percent positivity is at 3.6%, whereas in the most recent 7 days, it's slightly higher at 3.8%. Our median effect is once again below 1, and outbreaks in the region has remained high, though we are seeing a slight decrease recently, especially in this week. Our first dose coverage rate is 84.8% for those 12 plus, and we are now over 80% in our fully vaccinated population for those who are eligible to receive the vaccine. Thank you.
Thank you, Ramsey. We'll now take questions from the media. Today we'll start with CTV.
Good morning. Looking at these numbers, is there anything that is particularly surprising or concerning? Like, what is your takeaway from this week's stats?
Me?
I think it's a question for you, Ramsey.
Okay. Thanks for the question. So I think we are seeing improvements. Our case rates have continued to decline. I think the one positive thing we can take away is we are seeing less cases too in our school-age population, though relatively to all of our cases, they still remain high. The other positive sign is our vaccination rates are now over 80%, and we're continuing seeing incremental increases to where we want to go. There is still room for improvement, but we are heading in the right direction.
Would these numbers indicate that there hasn't been much impact from Thanksgiving gatherings, or is it still too soon to tell that?
Based on the numbers, we haven't seen the impact that we assume we'd see by now, though sometimes there can be a delay in what we're seeing. When we're looking at our wastewater surveillance data, it has remained unchanged from where we are, so there could be a signal where the possibility of cases who are symptomatic or have the infection may not have gone for testing just yet. So for us, it's continuing to monitor what we're seeing in our cases and to see if anything has linked back to Thanksgiving.
So Ramsey, if I could just ask then, So right now, the data doesn't suggest an impact of increased cases on Thanksgiving just yet. We don't see that impact. Is that right?
That's right.
Great, thank you.
Any questions from CBC?
Yes, good morning. I'm wondering if you have any details to share regarding the outbreak at Forest Glade Arena.
I mean, what specific details are you looking for?
Yeah, absolutely. So is it a big outbreak? Is it a small one? Who's affected, whether it would be staff or patrons? Was anyone involved unvaccinated or, I guess, ineligible due to their age? Anything along those lines?
So I don't have all the specifics, although Ramsey does. Generally, I can share in generalities. It doesn't take us a lot of numbers for us to declare an outbreak. I believe we have cases that are both vaccinated and unvaccinated, and I don't really have many more details to share. Ramsey, I don't know if you would like to share a little more, but that's about all we would have.
Yeah, the cases remain small. It was enough to raise concerns and for us to declare the outbreak. But in terms of the individuals impacted, it is contained.
Thank you very much.
Any questions from the Windsor Star?
Yes, good morning to everybody involved. I suppose, Dr. Nazature, what should people take away from seeing this week's data and the decline in trends in case counts?
Well, I think that the first thing is that it is a positive that the number of cases are going down and the burden of COVID-19 in the community is less now than it was in previous weeks. That being said, we still have a disproportionate effect of COVID-19 on young people, and we have dismissed, I think, up to this point, more than 300 cohorts or classes or groups of young people and excluded them from school. And to the extent that the burden of COVID infection is now disproportionately affecting young people, we still have to maintain our public health vigilance. It's worth noting that the reason we work on containment, especially among young people, is not only to prevent them from getting sick, but to break the chain of transmission from a young person to their parent, and from their parent to a grandparent, and from their grandparent to another older person who's vulnerable to die or get sick, or to a person who's unvaccinated, or to someone who's got multiple medical conditions that makes them vulnerable to COVID. So what we are working towards to try to break the chain of transmission. The other point I'd like to say is that although there are improvements, the fact remains that Windsor-Essex is still disproportionately affected as a community when compared to other health districts. Third point is it's heartwarming to see that the vaccination rates are improving, but it's still not where we want it to be. And really, a reasonable target, I think, is to get to above 90%. Ramsey can correct me, but I think there's at least one district that is above 90%. I think it's Leeds-Grenville, but
That's right.
That if Leeds-Grenville can get to 90%, then surely Windsor-Essex can get to 90%. And so I think we still have a long ways to go to get to the optimal vaccination rate.
Thank you.
Any questions from AM 800?
I was going to ask about trends, but that just got answered. So obviously earlier this week, Pfizer put in their data to Health Canada. I know it's still a big process before we even see the approvals on that, but have you guys had any discussions on what that rollout is going to look like in the future yet?
Well, Nicole, maybe you could answer that from an operational perspective.
For the 5 to 11 age group. So I think, we don't have the exact timeline yet. We are working with the province. We did submit our plan, as all health units have, in preparation. I think I answered this question on the radio yesterday, or talked about it a little bit, but we feel really comfortable in Windsor-Essex. We're lucky enough to, we still have a mass vaccination site, the Devonshire site, in partnership with Windsor Regional. And so, we'll be working on plans with them to, if it needs to be modified, certainly for a younger age group as well. We have, well over 50 primary care providers and are continuing to add more that will be able to deliver vaccinations through their offices. As well, we're working with pharmacies, and we still will be supporting in partnership with the high priority communities, Erie Shores and EMS, those mobile clinics out in the community. So as far as our plans go and our rollout goes, I think, we're just prepping for that sort of surge, and as well preparing to support the community as it relates to questions. We expect parents of younger age groups will have a lot of questions, but we're ready whenever that time comes, and I think in Windsor-Essex in pretty good shape.
And I think that the one thing if I could supplement that is that now's the time, I think, for families to have dialogue about vaccine. The vaccine has been demonstrated to be safe, and I anticipate that the federal authorities will ultimately approve the vaccine. But it's worthwhile for families, moms and dads, to have the discussion and think of how the vaccine program and the opportunity for vaccine can improve the lives of their own children, but also that of the community.
Okay. I'm sorry, did Blackburn join us? No? Okay, we'll go on. Any additional questions from CTV?
No, thank you.
Any additional questions? CBC?
Yes, I just had one more. The people who were vaccinated in Michigan or elsewhere outside of Ontario and have submitted their documentation to you guys, are those numbers reflected in our stats yet?
Yes, they are.
Thank you.
I'll maybe just add to that question, Taylor, as well, just to say that I think the last time we were asked, we had a bit of a backlog of a few thousand records that we were working on, and we're caught up. So they are reflected in our numbers, and we don't have large amounts of records that we're trying to process at this point in time.
Thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you.
All right. Thank you, everyone. We'll see you on Monday, October 25th. Have a good weekend.
Have a good
Thank you.
weekend.
Bye, everyone.
Bye-bye.
Thank you. Have
Thank
a great
you.
weekend.